Thank you. Hi, everyone. This is a presentation on Medicare by a representative, John Leung, who you can see on the screen, through HICAP. HICAP stands for Health Insurance Counseling and Advocacy Program, and they have been serving Medicare beneficiaries since 1985. They help people who are already beneficiaries or people who are imminent to be signing up for Medicare, as well as people who are eligible for Medicare due to a disability, and also help people with long-term care insurance policies, or if you have billing issues with Medicare and you may be submitting an appeal. So as one of the person earlier mentioned that they were bombarded with a lot of flyers and information from all the insurance company, you should know that Medicare is confusing, and but if you go to HICAP for counseling, it's all unbiased and volunteers will be there to help you. Our speaker today is John Leung. He is from HICAP of San Mateo County, and he has been a counselor for over 10 years. John has retired from his career in the biopharmaceutical industry. He and his family has lived in the San Mateo County for over 40 years. And he also volunteers at several other social service organizations. So at this point, I'll turn it over to John for the main event. And thank you and welcome, John.
Well, good afternoon, everyone. Can you hear me fine?
Yes.
Okay, good. So let's get started. I am from the San Mateo HICAP office. I want to let you know that there are some Medicare issues that are county specific. So if you want kind of personalized counseling, you should contact the Santa Clara HICAP office. They are in San Jose. You can look up their contact information online. But much of the information, or all of the information I'm going to share with you today, just general information that pretty much applies to everyone all over the state. Yeah, they are speaking of state, there are also state-specific issues with regards to Medicare. So Medicare is an enormously complicated matter. No country in the world does healthcare the way we do it. It is just a mess. And hopefully by the time you finish with me this afternoon, you would have taken a couple of steps further in your understanding of how Medicare works. Okay, next slide, please. So what is HICAP? HICAP stands for Health Insurance Counseling and Advocacy Program. We are part of a network, a nationwide network called SHIP, State Health Insurance Assistance Program. In California, we like to rebrand everything. So Medicaid becomes Medicare, and SHIP becomes HICAP. So here we go, and but the purpose remains the same. We offer free, unbiased, one-on-one counseling. All our counselors are state register, and everyone have completed a set of training, and including a period of internship. And we are primarily funded by the California State Department of Aging, with some funding from the federal government, and even a little bit from private donation. All right, so moving on, let's go to slide number 3. So today's agenda, I don't think we'll have time to go through all of them. But what I like to focus on item number 1 and number 2. The rest of the stuff, I think you can pretty much find out online. It's just a lot of reading. There are complicated rules and nuances regarding the first 2 items. So I like to just spend most of our time or all of our time on the first 2 items. What I found out from doing this is that people generally absorb or retain information better if the information comes to them as answers to their question. So I'm going to try to reserve more time for our Q&A sessions. Slide number 4, please. Okay, so as a Medicare recipient, you have a card like this. And there are benefits that goes along with having this card. Next slide, please. Next slide. Oh, yes. Okay. All right. Medicare insurance is a government insurance, and it's for people who are 65 or older, and also for people under 65 but with certain terminal diseases. Medicare is intended for US citizens and legal residents who have a work history or an account with their through their spouse or ex-spouse. Next, please. So original Medicare has 2 parts, and you probably heard this over and over through television commercials or sales calls and all kinds of junk mail. And primarily those 2 parts, Part A and Part B. Part A is for hospitalization, Part B is for outpatient services. I'll go into more detail about what's all entailed in Part A and Part B as we move on. Next slide, please. So, please back to slide number 6. Okay. So Medicare came about in 1965. It was enacted during the Lyndon-Johnson year, and Part A is funded mostly by payroll taxes. Whenever we get a paycheck, there's an item listed as FICA, and Medicare funding comes out partially through FICA taxes. Part B is funded 25% by the subscriber or enrollees through their annual premium, with the remaining 75% from the general fund. The next item is very important. Enrollment into Medicare is managed by Social Security, but the actual program is managed by the Center for Medicare and Medicaid Services. A lot of people are confused about this, and unfortunately, the federal government doesn't make it all that easy for you. So to begin with Medicare, you need to go to the Social Security Administration, or call your Social Security number, or visit. I don't know if any of the local offices are open, but you used to be able to just walk into the Social Security office to enroll in your Medicare Part A and Part B. So anyway, moving on. 7, please. So Part A, as I mentioned, is for hospital insurance. It also covers a skilled nursing facility. This is not long-term care, so please don't be confused with that. Skilled nursing facility is typically used for post hospitalization rehab. Part A also give you some blood transfusions and hospice cares. So next slide, please. Part B is essentially for outpatient services, such as doctor's office visit, ambulatory surgery, clinical lab tests, durable medical equipment, which include things like insulin pumps, and a few other things that you can find out more if you're curious. There's plenty of information online. Next slide, please. So Part A doesn't require any premium if you have worked 10 years or 40 quarters, and essentially you have already paid for the benefits. But it does carry a pretty hefty deductible, almost $1,600. And there are copays for hospital stays. Not the first 60 days, but after that, you might have to pay. Part B, this year, we have a premium of $170.10. Next year, there's going to be a slight reduction, like a 3% reduction. I think that works out to about $165. Part B also carries a annual deductible. This year is going to be a little less than $230. Next year is going to be a little less than this year's $233. But the big thing is that there is a 20% copay or co-insurance. So you hear this a lot from TV commercials that Medicare only pay for approximately 80% of the cost, so you're responsible for the remainder 20%, and this is what that is about. Next slide, please. So we know that Part A and Part B are not sufficient. We need something else. Next slide. And that is Part D, because A and B together still don't cover prescription drugs. And prescription drugs often works out to be the largest, not often, but to some people, turns out to be the largest cost component of your total healthcare cost. So it is very, very important to add Part D, although it's not mandatory, but we always advise people to have some kind of insurance for their prescription drugs. Next slide, please. So let's take a look at the cost again. Part A, as I mentioned, there's no premium. Premium basically means that you have to pay for the plan every month. Premium usually works out to a monthly cost. But there is a pretty hefty deductible, which I mentioned earlier, almost $1,600. And copay beyond the first 60 days. Part B, there is a monthly premium. Next year is going to be a little less, And there's a deductible, and again, as mentioned earlier, a 20% co-insurance. Part D, the premium varies a lot depending on the type of plan you buy. And the national average is running at about $34. That's the premium. But beyond the premium, there's also deductible and copay. Some Part D plans cover the deductible, but for those, you generally have to pay a high premium. And the low cost Part D plans don't cover deductible, and you will have to pay out of pocket $480 before you receive any kind of benefits. Next slide, please. So to sort of have the comprehensive benefit that you can get, you need the basic original Medicare Part A and Part B, plus an optional Part D plan and an optional and private Medicare plan. D and Part D and Medicare plans are private insurances. Next, please. Next slide, please. Oh, yes. Okay, so here they say that the premium for Medicare plan is $100 to $300. I actually have never seen a Medicare plan lower than $100 within in the last couple of years or so. The lowest cost Medicare plan in our area in California is $116 this year. Next year is probably most likely it's going to be higher. So it's more like $116 to $350, depending on what type of Medicare plan you have. There are many different Medicare plans, and we'll go into that a little bit more. Okay, next slide, please. So these are the different Medicare plans, not to be confused with Medicare, not to be confused with Medicare parts. So the parts and plans are different. Okay, there are 10-letter plans in California, but if your birthday comes after January of 2020, you will not be able to buy Plan C or Plan F. The best or most comprehensive plan that you can buy is Plan G. And essentially the difference between G and F is that G does not cover your Part B deductible, which I mentioned earlier is about $230 a year. But even if you can buy Part F, the likelihood is that you'll have to pay about $20 more a month premium. So it becomes a wash, financially. There's no great advantage in having an F versus a G plan. Okay, next slide, please. Part A, Part B plus G and Medicare, that's the full extent that you can have. And we can talk about the alternative to this strategy of having Part A and Part B with the optional Part D and Medicare plan later as we move ahead to other slides. The next slide, please. So what are the pros and cons of this model of having original Medicare plus Part D and Medigap? The main advantage is that you can go to any hospital that accepts Medicare, and virtually all hospitals accept Medicare. There are a few exceptions, but they're not they're far they're not very common. It says you can go to any doctor in the country who accepts new patients and is contracted with Medicare. Now that's true, but it's also a little deceiving too. Most doctors do accept Medicare. That is, they will bill to Medicare, but it is not. What is not clear is that a lot of doctors, especially the well-regarded, established doctors, they don't automatically accept new patients. Anyone who's looked for a new doctor would know from their experience that you can go and select a doctor, but that doctor also selects patients. So many of the established, well-regarded doctors are not accepting new patients. And that's something to keep in mind. So it's not the whole adage of being able to go to any doctor you want is not entirely true. But you don't need a referral to see a specialist. And Medigap also provides a more predictable cost because your premium, even though it's higher, generally higher than the alternative, your coverage is more comprehensive. Many of the plans will cover the deductible, and it also requires no copay. And with Part D for the prescription drugs, your Medicare and Part D plan can change every year, but there are rules. You can't change anytime you want. With the Medigap plan in California, you can change once a year during the period of 60 days following your birthday every year. That is called the California birthday rule. Not every state has that rule. So we're fortunate that we live in California, so we do get to change Medigap plan once a year if we want to. With the Part D plan, we get to make the change every year during the open enrollment period, which is coming up. It is from October 15 to December 7. Next slide, please. Oh, okay. Well, let's go back. The red item is really the con. So what is the disadvantage of having the original Medicare plus all those optional plans like Plan D and Medigap? Is that the Medigap premium, regardless whether you use the services or not, you have to pay it every year. So that's pretty obvious. And the premium, as I mentioned earlier, could be pretty high compared to the alternative. Next slide, please. Can you have something else besides the drug plan and the Medigap plan come up with a comprehensive set of healthcare coverage. Yes, you can, and many people have it. People have employer retirement plans or union retiree plans. So we're not going to go into the veteran plans and some other sort of government or quasi-government related plans such as railroad retiree plan. But for most of us, the most common alternative to Medicare and Part D would be our employer retirement plans or union retirement plans. Next slide, please. So what the retiree plan, the thing that you need to be careful is that that retirement plan is a suitable substitute to Medicare and the prescription drug plans. And you can verify this by checking what the plan's administrator, the union retiree plan or the company retiree plans plan administrator, if they're not, if the retirement plan is not a suitable substitute, sometimes it's called creditable, not credible, but creditable plan. If it's not creditable, then you might run the risk of losing your guarantee issue right. And that is a very important phrase, guaranteed issue right. With that right, you can buy a Medicare plan. These plans will not be able to not sell you the plan, but more importantly, they will not be able to require you to go through medical underwriting. Yeah, so it's always important to have your guarantee issue right. Next slide, please. Okay, this is a good time to pause for question and answer. So I encourage you to raise any questions you like.
Okay, there are just some general questions, John. One of them is somebody's asking if they can get a copy of the slides after the presentation. If not, no problem, because we will have the recording.
Mm-hmm. Yeah, so you will take care of that. Okay.
And somebody asked, can you address Medicare Advantage plans?
Yeah, that's going to be the next segment of the presentation. So we generally like to pause at this point because the issues are pretty complicated, and I want to make sure that you first understand original Medicare plus Medicare and Part D before we move on to Medicare Advantage.
Okay, yeah, so are there any questions specific to the material that John already covered?
Okay, if not, let's move on, and we can always come back to it, okay?
Okay.
So the next item has to do with alternative to what we've talked about earlier. The main alternative is Medicare Advantage. And it is on the right-hand side of this graphic. So what is Medicare Advantage? Medicare Advantage is an all-in-one plan offering, one-stop shop that includes Part A, Part B, and Part D. And you have to have Part A and Part B before you're eligible to enroll in a Medicare Advantage plan. By the way, that's true for Medigap as well. So the baseline that you have to have is Part A and Part B before you do anything else. In some instances, you can get a Part D plan if you don't have A or B, but for Medigap and Medicare Advantage, you definitely need to have A and B to begin with. Okay, next slide, please. So Medicare Advantage is also known as Part C, just to confuse us more. And as I mentioned, you must enroll in Part A and Part B before you are able to get Part C of Medicare Advantage. By the way, you can get either Medigap or Medicare Advantage. It's one or the other. You cannot have a mix of the two approaches or two models. You cannot have both of them together. You cannot mix components from each model. Okay, so probably the best example of a Medicare Advantage plan is Kaiser. They are the largest and the most prominent in our area. They're not nationwide, but where we live in California and most western states, Kaiser is very, very big. And it's typically network-based. It's also network restricted, so you got to be careful. And we can talk about the restriction a little bit more as we move ahead later. These Medicare Advantage plans often offer extra benefits such as dental and vision. But in practice, what they offer for dental and vision are not as good as their marketing material might lead you to believe. Generally, they're pretty low quality plans. The other advantage is that Medicare Advantage plans have a maximum out-of-pocket amount, or they cap the spending at a level usually somewhere around $5,000, beyond which you don't have to pay anything. Okay, so next slide, please. So I don't know if you can read these slides. This slide goes into a little bit more detail of of a couple of Medicare Advantage plans. A very well-known one is the AARP Secure Horizon plan. They actually have Plan A and Plan B. And then another well-known one is the Alignment Health Plan. The Alignment Health Plan is the only Medicare Advantage plan that actually offers a PPO option. PPO meaning that you can go outside the network, but when you do that, you have to pay a 15% copay or co-insurance, whatever. So on the third row, you can see that these plans have contracted hospitals and medical groups, and every one of these plans have a different set of hospitals and different groups of doctors that they're contracted with. And if you go outside of that network, you are pretty much totally on your own, unless you have the PPO option with the Alignment Health Plan. That's the only Medicare Advantage plan in San Mateo County that has the PPO option. I don't know if Santa Clara County has any Medicare Advantage plan that offers PPO. You can find out from the Santa Clara HICAP office. Okay, next slide, please. So here we go into a little bit more of the summary of benefit of these plans. So some of them have copays for specialists. Some of them have no copay for primary care providers, but a $10, $20 sometime. Well, I haven't seen any copay for primary care providers that's more than $20, but it's pretty typical about $10. Some of them have no copays, which is nice, and you do have copay with emergency room visit. By the way, if you have these plans and you are traveling, you can always get emergency care or urgent care, and without having to get prior authorization. So these Medicare Advantage plan will cover urgent care or emergency care visit even when you're out of network. I won't go into too much detail about all the other benefits. Because you can read them yourself. Next slide, please. So with the original, the work original really doesn't apply to this slide, so I wish we can edit it out. So what does Medicare Advantage plan cost? The premium range around $0 to $100. They usually don't have any deductible. Remember when we were talking about original Medicare with the Medigap options, there's like a $230 deductible every year. So you have to pay the deductible before you get any benefit. Medicare Advantage, you typically don't have any deductible, and sometimes you don't have any copay, right? So, so in general, it is less expensive. Next slide, please. Hit it one more time so we can see the disadvantage. Yeah. Good. So I already mentioned that Medicare Advantage is generally cheaper, especially if you are healthy. And you are part of a network, although that is both an advantage and disadvantage. You're part of a network, very good, but you're also restricted to the network. I talked a little bit about emergency care. You can get it when you're out of network. And I've already mentioned about the maximum out-of-pocket amount. You can also switch plan, Medicare Advantage plan, from Medicare Advantage plan to another Medicare Advantage plan once a year. But there are actually 2 periods that you can do the switch. You can do that during the open enrollment period from October 15 to December 7, or you can do it in January, February, and March, the first 3 months each year. If you make the change during the open enrollment period, your new plan will start on January 1st the following year. If you make the change during the Medicare Advantage open enrollment period, that is during the first 3 months of the year, your new plan will become effective on July 1st. So a lot of pretty pretty mess up rules. So you just have to be careful. And, watch your calendar, watch all understand all these rules. So the disadvantages with Medicare Advantage, so we talk about a little bit, is that it's restricted to a network, regional network. The term regional is a little deceiving depending on which Medicare Advantage plans. Some of them are basically restricted to one county or maybe the adjacent county. It's not like the entire Northern California region or the entire state. The other disadvantage is that you need to get a referral to see a specialist. Although that is not as big of a disadvantage as some marketing material might lead you to believe. Because most of us who want to see a specialist probably consult our primary care provider anyway. And if you are in a Medicare Advantage plan, you get a referral, you're pretty much guaranteed to get a specialist, as opposed to you shopping for a specialist yourself. And you might find that a lot of specialists, as I mentioned earlier, the established, well-regarded specialists basically have a full plate and they're not accepting any new patients. All right, the next item is the, go back one slide, the cost for the Medicare Advantage plan could be a bit unpredictable, but it's not really as unpredictable as you might think. It's unpredictable in the sense that you have a copay, especially if you see a specialist every time you go into, every time you get service, as opposed to most of the Medicare plan, which has no copay. But you do have the annual maximum out-of-pocket cost, which I mentioned earlier, is around $4,000 or $5,000 depending on the plan. But the biggest advantage, and this is your takeaway, I really want to emphasize this last item, and you really need to remember this, is that once you started with the Medicare Advantage, you can only make a change, go back to original Medicare plus Medigap during the first 12 months, which is your trial period. All right. So if you don't either go back or change to original Medicare plus Medigap after the initial 12-month trial period, you are most likely gonna lose your guarantee issue right, meaning that if you drop your Medicare Advantage plan and you want to buy a Medigap plan, that insurance company have the right to not sell you the plan, or they might make you go through medical underwriting, meaning that they will check on your pre-existing condition and they can charge you more depending on your health condition. Also, they can put you on a wait period. So in other words, they'll sell you the plan, but they don't cover you immediately. They're going to make you wait 60 months, six months, or 3 months, or whatever the wait period is. They vary from plan to plan before they cover you. So this last item is very, very important. Next slide, please. Let's see. Most of these I believe we talked about already in terms of your choice of hospitals and doctors. Obviously, more choices, more flexibility with original Medicare versus Medicare Advantage. And we also mentioned that with Medigap, you don't need a referral. With Medicare Advantage, you will need a referral to see a specialist. Next slide, please. All right, this is another pause for questions. Do we have any question?
Yes, there are a couple of questions, John. Somebody asked a basic question about when they should enroll in Medicare, at what age?
You should always get Medicare Part A when you turn 65. Because for the vast majority of us, Part A doesn't cost you anything. Even if you have a very generous employer-sponsored group health plan, you should still get your Part A. So I always advise people, get your Part A as soon as you're eligible. And the enrollment period is 2 months before your birth month, your 65th birth month, your birth month, and 2 months following your birth month. So you have those 7 months to do your enrollment. But if you have a generous employer group health plan, it's not that important that you missed the initial enrollment for your Part A, Medicare Part A. However, missing enrollment of your Medicare Part B could be very bad. Could cost you a lot of money. And Part B has the same initial enrollment period. The 7 months. 2 months before your birth month, and 2 months after your birth month. But if you don't have a suitable substitute for Part B, meaning an employer group health plan or a retiree plan or a union plan, and you delay or missed your Part B enrollment for more than 8 months when you first become eligible, you will then risk a late enrollment penalty. And that enrollment penalty never goes away. It stays with you for the rest of your life. Okay?
Okay. And somebody asked, can a Medicare participant use money saved in a health savings account, HSA, to pay Medicare premiums?
As far as I know, you cannot do that. Not for Medicare Part A and Part B, or even Part D premium. Maybe Part D, I'm not sure, but the latest information I have is that you cannot use your health savings account to pay for Part A and Part B premium. Well, Part A doesn't, for most of us, there's no premium, okay? So that's my understanding. I also know that there are efforts in Congress to try to make that change. I don't know if the change have already taken place or it will ever become effective. But you can use HSA to pay for a lot of other things, like your copay for doctor visit, your drug copay, and for other sort of ancillary medical needs, that might not be prescription drugs, but you might need it, such as dietary supplements and so on.
Thank you.
I
Go
just need for people to double check. This is Susanna. I thought that you can take HSA money to pay premium for Part B and Part D and Advantage plan, but not supplemental policies. So somewhere there should be some information that we can double check. So I suggest that we double check.
Yeah, that's as I mentioned. That's not the information that I learned. Although sometimes I'm a little behind, so it is easy to verify. And actually, when you enroll in Part B, you have to do it through Social Security. And the best people to ask is Social Security, whether or not you can use your HSA account to pay for your Part B premium. But as long as we're talking about Part B premium, I should also mention that if you are a Social Security benefit recipient, your Part B premium by default comes out of your Social Security benefit. You don't have to set up a separate payment method. If you're still working and you're not, or if you're delaying your Social Security benefits, you can then pay it by a couple of different methods. Either have the Center for Medicare and Medicaid Services, or CMS, to send you a quarterly bill. They don't send a monthly bill, they'll send a quarterly bill, and you pay it once a quarter. Or you can set up an auto payment via checking account or some kind of debit account monthly.
Okay, thank you. Somebody asked, does Medicare, traditional Medicare Part A and B, have an out-of-pocket limit?
Traditional or original Medicare Part A and Part B have no limit, but they limit the benefits. In terms of maximum benefit, that's what you get from your Medicare plan, not Part A and Part B. Now remember, Part A only covers certain costs when you go into the hospital. There's no upper limit. The Part B also doesn't have an upper limit, but what Medicare pays is typically 80% of your Part B cost. That is your outpatient cost. What Medicare Part A pays is the initial 60-day hospitals stay, not initial. It's pretty complicated. They're broken down into benefit periods, and there is a daily charge that you have to pay. But there's no upper limit. It's almost like a deductible, and that's when your Medigap kicks in. Your Medigap picks up the cost that otherwise you would have to pay when you go into the hospital. The cost that Medicare Part A does not pay. But in terms of upper limit or annual cap, no, there's no such thing with A and B plus Medigap.
Okay. Another question is, does Medicare cover any medical expenses when traveling outside the U.S.?
The simple answer is no, with some rare exceptions. And this probably won't ever apply to you. if you live near a national border, like parts of Washington State, and your closest hospital is on the other side of the border. Similarly, if you live in San Diego, and the closest hospital is in Mexico, then Medicare will pay for that hospital cost until your condition is stabilized and you can be then safely transported back to a hospital in the US.
Okay, thank you.
But a little bit more than that, but there's most of the plans do offer urgent care when you travel. It's not continuing care. If you are traveling in another country and something bad happened to you, you need to go into a hospital urgent care. Most of the plan will pay part of all of the cost that's necessary to stabilize you. The complication has to do with the fact that you have to pay first, and then you have to get an itemized invoice from wherever you're treated, bring it back, and then make a claim for reimbursement. And this is not from Medicare Part A and Part B, it's from your Medicare plan. The complication has to do with whether or not the plan understands and accepts that invoice. I've had a client who got sick and have to go to a hospital in Hong Kong and incur a pretty hefty bill, and she came back with a very detailed invoice, and her Medicare plan pay her back every penny. I also had another client who went to Cambodia, came back with a bill, but did not get a penny reimbursement because the bill is not understood by her Medicare insurance and it doesn't meet any kind of international medical standard.
Okay. We're running at 1 o'clock right now. I'm not sure if there's much more after this. I don't think so. So actually there is some more, but we'll have to probably wrap it up at this point. If you can stay on for another 5-10 minutes, John, to answer any additional questions, is that okay?
I'd be happy to do that.
Okay. All right. So somebody asked, stated that they have an HRA, and she's wondering if that's synonymous to HSA that was mentioned earlier.
I am not familiar with HRA. I don't even know what it is. I know, HSA, which is very common.
Okay.
Sorry about that.
Okay. And then Libby provided some more information in, she mentioned the publication New Medicare and You 2023, which I believe anybody who's of Medicare age receives in the mail. We also have copies available at the library. She refers us to that for how monies are used for healthcare expenses. Do you want to add anything else to that, Libby or John?
Right. We HiCap also publishes a condensed version of that booklet. I mean, the booklet from the book is a pretty hefty book. It's almost a quarter-inch thick that the Center for Medicare and Medicaid Services send out every year. Has a lot of material. A lot of them really don't apply to you. So what HiCap does is that it distills the information from that book and turn it into a sort of like a Reader's Digest version, which has only about 20 pages. and it also includes information that's more localized, more county specific. I'm not sure if the Santa Clara chapter or HICAP has a book like that. So you might want to check what the Santa Clara County HICAP and see if they have a book like that. It would be good to get a copy of that book. Much easier to understand than the book that the CMS sends out every year.
Okay, thank you. Kathy asks, is there an upper limit for Medicare Advantage for the first 60 days in hospital care?
There is an upper limit. That is the maximum out-of-pocket amount that I talked about earlier. It varies from plan to plan. Before you sign up for a Medicare Advantage plan, you should find out what that maximum out-of-pocket amount is.
Okay. All right. I think we have time for one other question if anybody has a question. Otherwise, we'll go ahead and wrap it up. Thank you so much for your time, John, and for this informative presentation. I know Medicare is very confusing, especially if you're new to it and you're trying to decide and make the best possible decision for yourself. As I mentioned, we will post the recording on the Santa Clara County Library District YouTube website, and I will send out an email to everybody who signed up for this presentation when it is posted. Okay.
Can I add something, please?
Sure.
Susanna.
Sure.
I just remember that if someone has a lot of prescription, you may want to have HICAP representative help you, right, John, to review your prescription and see if you should change your prescription plan Part D.
That's a very good point. I mean, I think often people overlook the cost of prescription drugs. And to some people, unfortunately, the cost of prescription drugs ends up being the highest cost component of your healthcare. So HICAP offers a drug search or Part D plan service. If you fill out a form telling us what type of medication you take, the dosage, and how frequently you take the medication, we will do a plan search and provide you with a very detailed report on what the cost will be. We will help you select the lowest cost plan, and we will help you understand what your month-to-month medication cost is.
Okay, thank you.